Okay, so welcome everyone. Good afternoon, good morning, depending on where you're joining us from. My name is Jacqueline McNeil. I'm going to be the main host for today's session, and I'm absolutely delighted to be welcoming you to the third session in our Reusables First webinar series. And today we're going to be talking about the important role that infection prevention and control professionals and teams can play as both collaborators and leaders to advance sustainability and resource stewardship across different care settings in the Canadian health system. And I'm absolutely honored to say that this session today is hosted in partnership with IPAC Canada. And I think this discussion is really important and timely as it's happening just before Infection Prevention and Control Week. That's happening next week from October 20th to 25th. So without further ado, I'm going to get us started. So as I said, my name is Jacqueline McNeil. I'm the administrative coordinator at Cascades, and I was the lead author on the Reusables First Approach in Healthcare Playbook. I'm also joined by my colleague, Dr. Fiona Miller, who is the director of Cascades, and she's going to be moderating our Q&A portion of the session today. And we're also honored to be joined by three outstanding panelists, Titus Wong, Madeline Ashcroft, and Lindia Dernis, who are all driving transformative work, both within but also beyond their organizations. And we're extremely grateful for their time and for them to be sharing their insights with us today. And I will be introducing them in just a moment, but before I do so, I just want to flag that this session has Zoom captioning with automatic translation. So if you want to enable this feature, if you just navigate to the bottom toolbar, to the toolbar at the bottom of your screen and select the show captions button, you can activate this setting so that if your preferred language is in English, that you'll be able to have the translation captions. And if you have any trouble with this, please just shoot us an email in the chat and we can help you out. And so to begin our session, I just wanted to take a moment to share that I'm joining from the northern shores of Lake Ontario in Toronto, or Takaranto, which means the place in the water where the trees are standing. And this is actually in reference to wooden fishing weirs that were used in the narrows of local river systems by various peoples across this region for thousands of years to catch fish to both feed their families and their communities. And the image on the screen here is actually a photo I took of the Humber River, which is pretty close to where I live. And I just wanted to share a visual as to where you would have seen these fishing weirs in the past. But Takaranto is also known as a gathering place, and it's the territory of the Huron-Wendat, the Seneca, the Mississaugas of the Credit, the Anishinaabe, and the Haudenosaunee peoples. But it's also home to many other First Nation, Métis, and Inuit peoples today, with over 70,000 Indigenous people both living and working in the city. And so I know we're joining from all different parts of the country, but as inhabitants of this land, as treaty people, as individuals who are interested in advancing environmental sustainability and planetary health, I strongly encourage you to learn about the history, the peoples, the treaties, and the land of which you live on, as it's our collective responsibility to ensure that our home is healthy, plentiful, and safe for all of us, but also for future generations to come. And I also want to take a brief moment to just share why we're joining here today. I think there's lots of folks joining us for the first time. So this series has really come out of the work that happened for the Reusables First Approach in Healthcare Playbook. This is a Cascades resource that was published earlier this year and was developed in partnership with Vancouver Coastal Health. And it built off their experience of establishing a reusables first approach to their procurement program. And so the point and the goal of this webinar series is to really explore some of those broader themes within the playbook, but also to highlight the work and the folks behind the work that we feature in that playbook. So that leads me to introducing our fabulous panelists for today. And I just want to say that their full bios are available on the Cascades website, but I'll just offer a very brief introduction right now before I hand it off to them. So our first speaker is Dr. Titus Wong. Titus is an experienced medical leader who has a passion for improving safety and wellness for British Columbians. He wears many hats, and I'm not going to list them all, but he currently serves as the Executive Medical Director in Medical Affairs at the Provincial Health Services Authority. He's also the Medical Director of BC's Provincial Infection Control Network, as well as a medical microbiologist at the BC Centre for Disease Control Public Health Laboratory. Next, I'm pleased to welcome Madeline Ashcroft. Madeline has been a nurse for over 40 years and currently serves as the manager of Trillium Health Partners Community Outreach Hub, Outreach IPAC Hub that serves Mississauga and South Etobicoke, and it was a hub that she launched back in 2021. Madeline is also the past director of standards and guidelines on the IPAC Canada board and was a representative to the Canadian Nurses Association as a CNA board director. And then last but certainly not least, I'm pleased to welcome Lindia Dernis, who is an anesthetist at St. Mary's Hospital Centre. Since 2019, Lindia has spearheaded a movement to reduce the ecological footprint of operating theaters, first in her department, but now at other sites across Quebec. And she works to raise awareness among healthcare workers of the importance of plastic waste and endocrine disruptors in medical equipment, but also to find ways to reduce the use of single-use plastics in her everyday practice. So we have a stacked lineup of panelists, and we're so happy that you could join us today. We're really looking forward to hearing about your work and your insights. And with that, I'm going to pass it over to Titus to start us off. Over to you, Titus.
Great, thanks, Jacqueline. I'll try to share my screen here. Go. All right, can everybody see that?
Yes.
Okay, brilliant. Thank you. It's an absolute pleasure to join you today. So good morning and maybe a good afternoon to everyone. I won't go over the many hats that I wear, but it is a great privilege to be calling in from the stolen and never ceded lands of the Musqueam, Squamish, and Tsleil-Waututh First Nations, who have been stewarding the waters and the lands for all time. I don't have any relevant disclosures, but I do want to thank some of the IPAC and planetary health champions who have been working at this intersection for quite a long time. And certainly any one of them could have been here talking, so it's a great honor to represent the larger group. And this is a slide that I think the audience is very familiar with, and really describing the healthcare impact on greenhouse gas emissions. And certainly in the United States, the estimated somewhere in around 8.5% of all greenhouse gas emissions are from healthcare. And the vast majority of that is in scope 3. And so you can see in that big blue blob in the middle there, everything from commuting, from waste, from construction, from manufacturing, all really contributes to these greenhouse gas emissions. And certainly this is something that we're all very familiar with. But you say, hey, you're talking about the US, how about Canada? Well, Canada's just as bad. You can see in the blue on the left panel A, what you see on the y-axis is the per capita healthcare sector greenhouse gas emissions. You see US leading the way, and Canada not far behind there is very, very high. And then also on the x-axis is our national spending on healthcare. And so not only is our healthcare expensive, we produce a lot of greenhouse gas emissions, so we're responsible for it. And not only is it a problem, it's a growing problem. You can see in panel B is slowly increasing. And maybe as a sector, we could justify if we had the best health outcomes in the world, but we don't. But if we look inward and say, okay, IPAC is part of healthcare, and so we have impact and we have some contributions to the destruction of the environment. Let's look at one aspect of infection prevention control, and in fact, a very visible aspect of our field is PPE, personal protective equipment. Right? These are the tools that we use on a daily basis to ensure the safety of not only our patients and their families and visitors and supporters, but also all of our staff. But these tools that we use have a really negative downstream impact on their breakdown products, poisoning our waters and our lands, creating toxins that impact not only wildlife, but also human health. And that's not even considering the cost of the creation of some of those scope 3 considerations. How big is it? How big of a problem is it? And so some estimates during the pandemic put mask use, disposable mask use, 120 billion, and glove use at over 60 billion per month. The vast majority of that ended up in landfills. And these are things, again, these are the tools of our trade for safety. So is there a better way? So of course is yes. So this is a nice little graphic looking at an idealized circular economy for PPE. And certainly, I love the conversation about reuse because that's where we ought to go first, right? Instead of a single-use gown, can we have a reusable gown? Can we, instead of a single-use face shield, can we use a reusable, et cetera? So if we can't reuse and it's broken, can we repair it? And if we can't repair it, can we repurpose it for something else? Can we recycle, et cetera, et cetera? And maybe you say, hey, policy is not my jam. I'm actually more on supply chain and purchasing. Well, can we purchase from a more local manufacturer as opposed to shipping something from across the globe? So there's always something that we can influence from infection prevention and control. Something that we can do. I always like the idea of Tuesday ideas, right? The idea that you can do something next Tuesday. And so here's one. This Vitacore is a BC PPE manufacturer that is part of a PPE recycling program. And I'm sure there's tremendous number of other recycling programs across the country. This is one of them. And your team can sign up to be part of this program. That's something that we can influence. But mostly, I want to share the stories of some of the IPAC and planetary health champions. And I know there's many, many more. But this is a little snippet of some of our local champions in British Columbia. And I do want to put up this slide a little bit because oftentimes, so we say, what can we do? What can I do? What can I change? And if you really want to create social change and make an impact, you don't have to do things big. It could be everything from just a conversation, finding a barrier, creating awareness, to starting programs. So there's always, like I said, something that we can do. So I had a picture of Victor Liang, my good colleague from Providence Healthcare. He's an infectious disease physician, microbiologist, and infection control physician. And the two of us are very passionate about infection control and also planetary health. And so we created a provincial planetary health and IPAC group, interest group. And the only requisites to join is that you have an interest in infection control and planetary health. So anyone can join. And it's creating an arena for us to share some ideas, some creative ideas, share some struggles, and also encourage each other in our work. And one thing that came up was we realized that all our infection control colleagues across the province were receiving questions about, is XYZ product safe, reusable product safe for use? Or is this technology safe and from an infection control perspective. So we said, hey, we could create opinions that can be shared provincially. And then in that work, we realized we ought to have some kind of assessment matrix. And I know that there are many assessment matrices across the province and the country. This is one that Kathy Bush, Regional Director for IPAC and Interior Health, that she developed. I call it the Bush Matrix. She does not support that name, but I'm going to call it that anyway. And it really is designed to help us assess whether or not technologies or products are both IPAC safe and appropriate from a planetary health perspective. It really create a place for conversation between infection control specialists and planetary health champions. So really excited about this work moving forward. Or maybe you say, hey, look, product assessment is not my jam. I'm really interested in education and knowledge translation. Well, Tamara Molden is an infection control specialist at PHSA. She worked along with Mark Hutzblom and Abby Yellen and a number of colleagues from the ministry to create a perioperative planetary health and sustainability curriculum. And that's been completed, and we will be launching that shortly. So that's something that you can connect in with your colleagues in the education sphere to deliver in any, whether it's peri-op or search or emerge or anywhere else. My friend Victor, maybe you say, hey, look, education is great, but I want to be at the clinical interface here. And so Victor is one such person. He did a number of projects related to the clinical interface. And here we have a Glove Smart project, because it's not like we can use gloves, reuse them readily. And so we can challenge whether or not we need to wear them in the first place. Or it's about, he encouraged using tap water instead of sterile water in terms of flushing colonoscopies. And so having an infection control specialist, an infectious disease specialist advocate for a planetary health initiative is very powerful, because of the credibility that you bring, saying that this is safe and this is appropriate. And he's also doing a tremendous work with metered dose inhalers and changing beliefs and practices there as well. And he's taken a lot of these protocols and ideas and shared them with our provincial partners at our interest group. And so everyone can do their own pilots if they wish. And finally, I wanted to put a spotlight on my good colleague, Jesse Cooper. He's an occupational hygienist. The two of us, along with colleagues at Vancouver Coastal Health, I want to acknowledge Alison Muniak and Rachel Ritchie and Susan Sinnott, Julie Freketich, for creating a PPE test lab. In this lab we created during the pandemic, it was designed to ensure the PPE that we have was safe for use. Now, things that we did had to follow our principle to be of sustainability and improving planetary health. So, for example, we worked with local manufacturers to develop their PPE so that their PPE could be sold back to our provincial system. That way, we wouldn't have to source PPE from all across the globe. We can source it in our own backyard. We work with researchers on biodegradable respirators. So they knew how to create the materials that can degrade, but we knew how to assess whether or not they were safe for use. Another thing we looked at was if you try to reuse respirators through decontamination methods, if they continue to be safe, so our lab tests for that. And more recently, we've been doing a lot more of challenging expiry dates. And so we worked to look at a big lot of expired PPE, and that's of gowns. And we found that over 2.2 million gowns that would have gone to the landfill were actually still safe for use. So And then there were some that were not quite meeting the appropriate level 2 safety level, and we repurposed them for level 1, really following that idealized circular economy for PPE. So this is something that we can do for other colleagues across the country, and really keen to hear back if you're interested. But I just want to thank all of the IPAC and planetary health champions in BC, and looking forward to the discussion. So I'll hand over now to Madeline for as the next speaker. So thank you very much.
Thanks very much, Titus. I'm just going to bring up my slides here too. And while you were talking, I added an extra one at the end. So thanks everybody for joining us today. Just a quick correction. I'm no longer the manager of the IPAC Hub because I'm semi-retired now, which gives me time to work on things about which I'm passionate, which includes sustainability. And I know that doing it off the side of your desk is really hard. We're all so terribly busy. So I'm joining you today from the treaty lands and territory of the Mississaugas of Credit First Nation. So just further west up the lake here from where Jacqueline is. And what else was I going to tell you about that? Yeah, I think that's it. So sustainability and IPAC. Well, I hope you have heard about our position statement. I'm really trying to promote this. We have a position statement at IPAC Canada on environmental stewardship, sustainability, and planetary health related to IPAC. The title is a bit lengthy, but we just call it the Sustainability Position Statement, and it is on the website, and I am assured it will be in the full version of the Canadian Journal of Infection Control. So I have until tomorrow afternoon to change the formatting to APA. So look for it there, and as much as possible, I put links in the slides so you can just click on things to go and look at these various documents. So also, I shared a poster that I presented at the 2025 IPAC Canada Conference, and highlighting our collaboration for sustainability. I tried to make it look, sort of planetary and so on, but the sustainability collaboration is the main emphasis of this. I was asked to talk about the impetus for developing the position statement. And I have to say, really, it came from the Ontario Anesthesiologists, a sustainability working group, and they reached out to IPAC Canada to say, can you help us regarding a position statement on extending the use of OR breathing circuits, which is something that has been mentioned by Titus and also will be mentioned by Lindia later on. So there is a lot of info out there, which is great. But I said, as Director of Standards and Guidelines at the time, I'm not sure we can do something just focused on a particular device. Perhaps it should be a more generic position statement, looking at sustainability overall. And the Standards and Guidelines Committee and the board agreed to this, and we all recognize this gap in our Canadian IPAC guidance. So Dr. Lisa Hutchinson, Dr. David Orling, and Dr. Melissa Ho were particularly wonderful in sharing all kinds of documents and links and so on and articles for me, including position statements from other professional associations in Canada and beyond. So I've just given you a little sampling of some of these. Now, I've actually been a nurse for more than 50 years now. So I didn't really know even about the CNA one. Even having been on the board, it was something that I guess skipped my attention really, especially during COVID, because weren't we all so busy just to try and keep people alive? And then the CMA, also Canadian Medical Association, and then a collaborative one for climate change in Canada, and the Canadian Anesthesiologist Society, and CAPE down below. So all wonderful organizations and professional associations that have position statements and all sorts of useful information and resources about sustainability. Cascades, of course, who is hosting today's presentation, I hate to say it, but previously I thought Cascades was toilet paper. And so it was like, oh yes, I know Cascades from being a lifelong member of Greenpeace are they have an environmentally friendly approach. And then no, this is a totally different thing. And so it opened my eyes to discover all the wonderful resources that Cascades has to help create a sustainable Canadian healthcare system in a climate crisis. So not just today, but the modules and the other resources, fantastic learning opportunities for all of us and opportunities to collaborate. Other sustainability collaborations that I've become aware of as the Canadian Coalition for Green Healthcare, um, Healthcare Without Harm, CHASE, the Canadian Health Association for Sustainability and Equity, the Collaborative Center out of the U of T, and Peach out of McMaster. So this is just a sampling. There are lots. And I think maybe sometimes it's a little confusing. People get lost in, oh, there's so many different ones. But I'm noticing more and more that people across these organizations, often the same people, and collaborating and trying to get others to join in. So, what was the impact of our position statement? Well, right away, new partnerships and collaborations. So, the Canadian Coalition of Green Healthcare contacted our executive director, Jerry Hansen, to say, we're putting a position statement in our Green Digest. That was back in April. And so that was great. It was out there. And then Cascades has been connecting with us quite a lot including today's panel discussion, but also an upcoming IPAC Canada hosted webinar on November 19th, where Andrea McNeil from Cascades will present. So it's really good to really start to begin these collaborations. And really, I would say this is just, we're just starting on this journey, but it is a really incredible journey and of great importance. So looking forward, one of the things we'd like to really note is we need to get that increased sustainability literacy in those of us who work in infection prevention and control. And BC, wonderful, way ahead of the game there. But with us and with our allied professions, people need to know what there is out there. And for us in IPAC, people need to know about the position statement. So we're continuing to try and promote this and get all our members aware of it, because they are going to be tapped on the shoulder by others in their organizations to say, I need IPAC input on this. And, some of those things that Titus spoke about. So it's really critical that we as ICPs are really aware of what it means to sustainability and IPAC and what we should be looking for in some of these things, whether it's product evaluation, processes, putting, reprocessing first. So those who are currently in these professions, very important to catch up, really. And then students. So I think I'm aware of a number of initiatives where students in various healthcare professions are being presented with some of this information. So it's getting people before in the professions, which is great. For also considering the environmental impact of the IPAC products and practices. So it doesn't have to happen overnight, though. It can happen by next Tuesday. But stopping and thinking about, okay, before I use this, how is it going to impact the environment? Before I recommend this, can I recommend it to be used in a more environmentally friendly way or a better product? And I think better products is a really key thing we can work together on, right? Thinking again as reusable as a default. If a product is sturdy and looks good, and the manufacturers say, "Oh, single use, throw it away." Well, no, this could be reprocessed. Give us the instructions. Give us the repair information. Help us to be able to sustain the use of the product in a safe manner. Reprocessing instructions, replacement parts, as I just mentioned, really all part of the same sort of package there. I think that I've noticed, speaking to some people over the weekend who were climate change deniers, I thought, oh, this isn't going to be very helpful. Really, I can't believe some of the things people tell me. But certainly, I found that if I focus more on the impact of plastics on health, they were much more engaged. It seemed like even climate change deniers are concerned about the plastics in their bodies. So if I can, I'm telling them that plastics are a petroleum-based product, and they, but then when I say, it's in every organ of your body. Oh, yes, I was reading about that. So I think, we can certainly spread the word together and work together to find that common ground, even with people who are, dubious about what we tell them, even despite the evidence. So I just added this slide, which promoting the International IPAC Week, which is coming up next week. Bridging gaps, building bridges, and I just think the theme of it fits so well with this, with climate change, with deplasticization, with all these things we're talking about for sustainability, working together to achieve a better, safer, cleaner world for the future. Anyway, thanks so much.
Thanks, Madeline. And now over to Lindia.
I was supposed to introduce Dr. Lindia Dernis. Sorry, Lindia.
It's all okay. Thank you, Madeline. I have the not easy task of recounting how the challenging exchanges with the IPAC teams are really going on the ground. And I'm going to talk to you about two projects. And I have to say that they were started and actually finished before the IPAC sustainability position statement. And I'm sure that since this statement is out, I'm sure things are are easier. Our first project was about anesthesia breathing circuits. So it's like the tubing, the plastic tubing you see surrounded by red. And we would change them for like every general anesthesia, and we would have to change that circuit, and sometimes even the little green balloon that you see. We had to start explaining first to the IPAC team, well, what is this circuit? How often do we change it? How do we use it? Does it touch the patient? Does it touch the machine? How do we change it? What manipulation? And the first thing was that to explain why we would like to change it. We had to explain where our desire of change came from. Plastic pollution, microplastic, endocrine disruptors, PFAS, everything. And we really had to start from, like very far, so that the position statement is really going to help the next project. And we had also to explain that our ideas were not based on a lack of consideration of infectious risks for the patient or even risks for the patient. We had to make it clear that the status quo was also a huge risk for not only that patient, but for every patient and future generations of patients. Even it was a risk for the sustainability of healthcare on the long run. So we had to really work on this, and it was not easy because when you get some person, like one person from our IPAC team, and you explain it, but you have explained it to only one person. And we've realized that when you ask something to one person of our IPAC teams, I don't know how it works elsewhere, but we've realized that they bring the information to their committee and they only take collegial decisions. So when you give an information, your information is lacking. We never got to present to the whole committee. So we always had this loss of explanation and information. Another I would say difficulty that we had is that we don't have the same vocabulary. whether the anesthesiologist or the IPAC team. And so we had some quiproquo, we had some misunderstanding, and it really was not easy. And another big obstacle is that whether us or the IPAC team, well, all this is extra. This is over our work. So it does take a lot of time, especially you provide, for example, all the literature on that new possibility, but then, and it's understandable, the IPAC team has to go over their literature. So it does take time. And after numerous email exchanges over several months, we never got to meet. Our IPAC department agreed to let us start using circuits that are approved by Santé Canada for 7 days, but provided that we monitor for 4 or 5 weeks, and we would swab in and out those circuits at the end of the 7-day use. Of course, raises more questions. Who does the sample, the swabs, who bills for the analysis, all those kinds of questions. Everything was solved. We accepted, of course, all the tests came back negative, and we were able to confirm our use of the 7-day circuits. We were the first in Quebec, and our experience really helped launch a real revolution here in Quebec. And other anesthesiologists and we were part also of working with public health in Quebec to try to change also the guidelines to make that change easier for other teams. So building on our success, we were given one person to be our go-to person at our IPAC team when we had a new project. So we decided to be a bit more bold and innovative and ambitious. And so we wanted to try washable surgical masks in the operating room. So we sent a full literature, we sent like a lot of studies, we sent a full dossier to that go-to person, and we got a no less than 24 hours later. So we had to go back and we had to start all over and explaining why and when. And let's be honest, it was not an easy project. They had, our IPAC team had to go over literature, legislation, what are you allowed to do in the operating room, and a lot of things like this. And also, that team, it's not their mandate to work on such complicated projects. And I get it. And it's not, we didn't have like real support, whether financial, technical, time support from high up hierarchy. It was just really on a voluntary basis. So again, we've never sat in the same room, which would have been really, I think, helpful. But because we are a groupment of hospitals and one is working here, one is working there, and it's very difficult to, like sit at the same table and try to see what's missing to get maybe or yes or how to do it. We were asked to write a protocol on how to use a washable masks, for example, but we didn't have a protocol to know how to use a single-use mask. So it's some of those things that, we have the burden of, making the proof that washable is at least not worse than the single use. Why would it be like this? The single use ones, we went from, washables decades ago to single use, not for infectious purposes, but for economical purposes. But now that we want to go back, the healthcare workers have to make the proof, and it takes time and time and time. It was very tough. we had a lot of ups and downs, whether it's on the IPAC team or on our team. And I think that there's really something that is missing in the healthcare system. All the people that are really involved in all this, they are not trained to collaborate really together, whether it's the IPAC team or whether it's the healthcare worker that want to bring a project. Not only are we not trained to collaborate, like in companies, you have like it's what I'm showing you. In companies, you have all those things that you're taught and everything. But we were only healthcare workers. We've studied many years, nursing care, medicine, or else. And collaboration was not at all in my training, for example. But project managing wasn't either. Writing protocols wasn't either. And if you don't have help from higher up, at least in people who knows or can drive you to collaborate together to try to, like find a common place where everyone finds what they need to officialize a project, it gets very tough. Just to let you know that this project, after more than 2 years of hard work, we were able to launch the use of washable masks at St. Mary's OR. And I think everyone who took part of that project was very, very happy. And I know that I'm going to stop here because people have probably a lot of questions. So thank you, everyone. Fiona, your turn.
Yes, thank you so much, Lindia. So I have the distinct pleasure of jumping in after all of the amazing speakers to ask questions. And I have many, many questions. And please, there's some questions starting. I think all of our speakers are going to come on the screen and we'll all be here together. And I actually want to start with, perhaps it's a cheeky question, but I think it's a question worth asking, which is, certainly within the sustainability world, IPAC and infection control is recognized as vital, as at some levels a fundamental to sustainable care, because preventing all sorts of harms is an incredibly important way of reducing the environmental impact of healthcare as well as improving outcomes for those individuals. But then there is the point that IPAC practices and policies and procedures, or certainly their interpretation and use, is often named as being one of the challenges getting in the way. So I guess my question, if I may, is that perspective on IPAC a myth? Or is it that there's a change and we're seeing a change in the thinking and the culture and the approach within the infection prevention and control community? Who would like to start us off on that?
Can I
Yes, please.
start? Hi. I get this all the time. I get this in meetings where I'm talking about our sustainability position statement, like communities of practice with our nurses in non-acute settings and so on. And other people are saying, whoa, wait, oh, that's not safe. That's not safe. And I think this is something that's grown over time in IPAC. We often get called the enemy of sustainability because over the course of time, when lapses were identified and reprocessing and so on, it was highlighted as, oh, if you can't do it safely, you better not do it at all. Better to just use a single-use item so that you can reduce the risk, because you can't trust people to do their jobs properly and so on. And I think that's wrong. We have to say, no, we have to focus on getting people to do things correctly and realizing the benefit of it. I also get pushback from people who are working on even on like CSA documents to say, I hope you're not in conflict with us, because we think that the use of water and electricity to reprocess things makes it much more expensive than just using a single-use item. And even they've thrown in transportation there, which I just don't think that flies. But to say that, I'm saying, well, if you're just looking solely at cost, financial costs of the particular item, it's a different thing to look at the entire cost to the environment and to human health, and factoring that element in, and also the plastic side of things too. So this is new. This is new to IPAC. I really think we've gone for so long the other way that it's really a reverse position. And I do think that people are looking to experts, not so much me, but physicians, I would say, like Lindia and Titus. They people believe doctors more on these things, I think, than they do nurses. But just to say, no, this can be done, and this is better, and this is why it's better, and getting people
Right.
to open their minds.
So a shift, perhaps. Titus, yeah.
I'll jump in there, and Madeline, you're very well respected. So I would say that the change in perspective is healthcare wide. I'm gonna acknowledge that I'm speaking from a place of privilege in that the organization that I work for has as one of their North Star priorities sustainability and planetary health. And so the conversations that I have, Lindy, I was feeling for you as you're describing your experience, because that's not the experience that I have. And so what this speaks to is that there is change, as Madeline mentioned. The change can't happen fast enough. And this is, I think it requires leaders who are on the call to work within their sphere of influence, because I think the experience that Lindia had, I mean, that could have gone very different, right? And so when I talk about some of the creating a interest group with infection control and planetary health champions together, this would be a place where it's something that Lindia's experience could be brought up. And certainly we've had people come to our group and say, hey, what do you guys think about, you as infection control specialists think about this? And we work together to find a safe way to use the reusable, right? So I'm encouraged, but that's my Pollyanna perspective on life. But I think that, yes, in the past, it has been maybe some challenges there, but I think globally in healthcare, there's a slow transition to where we ought to be.
Right. Any further comments on that, Lindia, or? No, good. So there's a lot of questions coming up, and I know we won't get through all of them, but I do want to talk about the state of the science question and the need, sometimes the difficulty of going up against, say, a manufacturer's sort of statement about this is a single-use product, and what you need to mobilize in order to respond, in order to operate differently. And I think what, the BC testing lab is really quite extraordinary in terms of mobilizing that kind of capacity. So how much of that do we need around the country? What is the capacity to utilize I think there's one in Toronto as well that was during the pandemic also doing some basic safety testing, but they haven't taken it in this direction of trying to answer some of these sustainability questions. How much capacity do we need? How do we share this capacity? Is that possible? Is this sort of a province by province or region by region? We need to build this, or can we answer these questions once and it's done? And then others can proceed on the basis of that.
I'll jump in first. Part of the reason why we wanted to create the IPAC Planetary Health Group is create these opinions that can be shared. Right, and we wanted these opinions to be robust, and so we had the assessment matrix. We do not want to duplicate work, and so I think having planetary health and IPAC experts together, co-creating those opinions lends a tremendous amount of credibility to those statements. In terms of capacity building, our PPE lab is not. It has been working with PHAC and CSA as well. We could take on work from across the country. Just reach out. I do feel like being able to challenge the expiry dates is powerful. Obviously, it's something that needs a little bit more work. But then also the other component is working with local innovators about, and I was just so excited to hear about the washable masks, right? Like those are exactly the types of groups that we'd work with. or traditional PPE manufacturers that are, again, local in Canada, so that we can cut down on the transportation impact from across the globe. And then finally, there were some questions about reusable gowns. I'm a big fan of reusable gowns. Something put out a position statement from Vancouver Coastal during the pandemic about it. Elastomerics, I also agree. These are things that we ought to consider. It is something that we also tested out and used during the pandemic. So, yeah, if you're interested, reach out. I'm going to probably be chatting with Linda later about some of her mask experience as well.
That's wonderful. Maybe I can ask Linda to talk a bit more about the challenge of culture and how you forge these collaborations, especially in the context of people having very limited time and capacity typically. Do you think there are general lessons that you've learned about how to do this work that you could recommend to others, or is it very, very moment and site specific?
My first lesson was don't take no for an answer. And go back and see and try to re-explain we really don't have the same vocabulary. We don't have things in, even before those projects, I was trying to explain how much waste we were generating in the operating room. And the only way I was able to make or high administrative understand was to do an audit and come with the numbers and saying, well, we're just generating 1 ton a week. 1 ton of waste a week. We have only 6 ORs. That's huge. And when you come with numbers, then they're like, oh my gosh. So you really have to try to not take no for an answer and explain your point in a different, it's probably because they didn't understand. You're trying to make the world a better place. And they have to understand that, again, you're not trying to have, you're not having a tantrum just because you want to try a new thing. You're here to try to make things better for now and for the future. For the mask, I was also trying to explain to them, well, the healthcare worker are breathing endocrine disruptors, microplastics, PFAS. In a lot of masks, there are PFAS, and we're breathing them every day. It's harming our health every day, not only nature's health, our healthcare workers' health. So it's important that this is taught and that's it. So when you get a no, or when you get a oh, you go again and you say, well, I'm trying to explain to you. But the people need to have time. You don't just go there and try to explain, climate change, scope 1, 2, 3, and like this. You have to have them give you time, which is not that easy. So sometimes you have to try to go around.
Right. Well, so that sort of leads to maybe my next question, which is about the influence of organizational culture or strategy, and then at the next level, provincial. Madeline made a comment on BC being ahead of the game on this one. I think there's quite a lot happening in Quebec. I would say that Quebec is a place where there's quite a lot of engagement, and other provinces to quite varied degrees. But pretty much all of them more than Ontario, may I say, coming from Ontario, but at the provincial level. But organizational strategy and organizational culture, I think could be quite influential. But I wonder if folks can reflect on or comment on the extent to which this is really work that you have to do with individuals. So what you were describing, Linda, which presumably always would have to be done. You have to go to these people, you have to bring them on board, you have to find the time, make the argument, create the vision, align the teams. But then that organizational culture or strategy may make that a starter or non-starter. I don't know. And similarly, the different provincial contexts that folks are working in and how influential that is. Would you have some reflections on that set of factors? Lindy, do you want to start? Because you're coming at this from Quebec, and maybe that, I don't know if you want to comment specifically on that hospital, but maybe the province or the context for making change.
What I see is that on the ground, people are really motivated. They want to change things. Higher up, it's very difficult. The health ministry here in Quebec is knee-deep in negotiation with doctors. Things are really not going well. The healthcare system has a huge depth. I don't think sustainability is on their board at all, but people are ready. And when I see what Titus is doing, and when I see what exists across the country, what I see is that I think we have, even if you don't have support of your hierarchy or anything, showing that in one hospital it's been done. That it took time, it took tears, it took screams, it took a lot of things, but it was done once. And then you can replicate. For the mask, we're not there yet, but for the circuits, for example, we are there. And it was an easier win than expected in the end, but deserved. But I mean, like when you start in one place, it's gonna bring something else. Even if you don't have support from either your society or your hospital, you can get somewhere. You can be at first maybe in a little thing, but it'll bring so many others to come after you. And that's, like we have to do that step. And in other places, maybe like BC, it'll come from higher up. But then we'll meet in the middle. We have to try at our small levels, like really like mine, on the ground, and we have to try higher up. We'll meet in the middle at one point.
Titus, did
Yeah,
you want to? Oh, sorry, Madeline, go ahead.
no, Fiona, I was just thinking that really agree so much with that. I think that those of us in IPAC have been, as somebody in the chat box said, they're traditionally risk averse and so on. And we want evidence, right? We want to see the evidence. So if other people have the evidence, how can we help people to publish that evidence so it's readily available? And awareness of what's going on in BC and sharing of these tools and so on. So we don't have to reinvent the wheel. I know one of the anesthesiologists said to me, how come when I talked to my IPAC team, they said no, and then some other ones said no, and then they started contacting other IPAC teams around the province, and some said, oh yes, we have something like U of T and so on, and Trillium, where I work out of it to some degree. So it was like, oh, okay, yeah. Don't they look at evidence? Why are they looking at what others do? And I said, because the evidence is not always easy to find. And you wanted to balance somebody might say this, but it's one article or hard to find. So increasing that awareness, I think, is really a key part of what we in IPAC certainly have to do. Right. And having all the other specialties work with us and so that we support these initiatives and look for things that are better for the environment and processes and products.
Titus, I'm going to give you the last word because we're going to stop a few minutes early to bounce to Jacqueline. Did you have any final comments?
Yeah,
on the BC
I would
context?
say this collaboration is a really good example of a great starting point, right? Or continuation of the partnership, right? IPAC Cascades is a really, really powerful connection. I would suggest to really connect with industry. You had Barry Hunt ask a very, very pertinent question. We can't ignore industry. We have to work with them. And so I think that that's something to consider. The final piece is there are allies within the Ministry of Health. And whether you have financial pressures or not, there are equally passionate people within each of our ministries that we can connect with. So find them. And finally, it's reaching out to your fellow colleagues. I would encourage every infection control expert here. You're here because you're interested. Find your planetary health colleagues and champions in your system, and vice versa. Your planetary health champions, go find your IPAC colleagues, and you can use these presentations as a starting point. And I really encourage anybody who is interested in any of the great work by my colleagues in BC, reach out and be happy to connect you with them. So thank you very much.
Wonderful. And with 1 minute to spare, to pass this back to Jacqueline to close us off. Thank you so much for an amazing conversation.
Lovely. Thank you so much, everyone. Thank you, Fiona. Thank you to our panelists. I think there's incredibly thought-provoking and interesting discussion, and you've given me a lot to think about, and hopefully everyone in attendance today. I think I don't have time to share my screen, but I just wanted to say that we have another webinar in this series coming up. It's on November 13th. It's going to be in partnership with the Collaborative Center for Climate Health and Sustainable Care, and it's lessons learned from unsuccessful projects. So we're going to hear from speakers that are going to share about why a reusables switch didn't quite work out. They're going to share about their challenges and barriers and quick wins. And so we're really excited. We think it'll be a great discussion. So if you're available, then we would love to have you join us. And yes, thank you so much again, everyone, for joining us today. And I hope you have a fantastic rest of your Thursday. Cheers. Bye.